In 2019, two of the largest ICU in major Sydney hospitals, that's Westmead and St. George Hospital, lost their respective college accreditation because of bullying and harassment complaints. How about if I tell you back in 2017, there was an official complaint against Australian College of Emergency Medicine made by migrant doctors who felt discriminated against when it comes to passing the OSCE component of the final fellowship exam. When I was migrating from the UK to Australia, one of my friends said to me, Australia is a very racist country and postgraduate exams are extremely hard to pass. I found myself sitting in my director's room explaining why I prescribed an endone. He said to me, Doctor, you're making a mistake. He later lodged a complaint. 5 years ago, a leading female vascular surgeon openly talked about a culture of harassment against women in surgical training in Australian hospitals and Royal College of Surgeons not doing anything about it here in Australia. So that's the context. Let me make one thing very clear to all the doctors, especially IMGs anywhere in the world. If you've ever felt that you've been discriminated or bullied or harassed, lodge a complaint immediately. I have faced multiple complaints, workplace bullying, and even exam struggles here in Australia. In fact, I remember when I was migrating from the UK to Australia, one of my friends said to me, Australia is a very racist country and postgraduate exams are extremely hard to pass. Of course, he was just trying to warn me of what he had heard without having any first-hand experience. After 18 years, I can share a better perspective, a more pragmatic one. Also remember, all the problems can be subtle and you may not realize initially, but awareness and raising voice is the key. To say that Australian job market is flawless with excellent salaries and optimal working conditions, it's not the message that I want to convey. So Australia has got a lot to learn still. To highlight various issues, I will divide this video into clinical work expectation, number 2, complaints from both nurses and patients, exams, in particular fellowship exams and OSCEs, bullying and harassment at workplace, and my experience working in the UK versus Australia. And finally, I'll lay out my conclusion in your open court. Clinical work expectation. Despite me having a good reputation of doctor who sees most patients, this one time during an emergency shift, which by the way was a bit slow and very quiet, a very senior consultant asked me, how many patients did I see? And I said 3. And he said, Rizwan, that's slack. I replied very quietly that there hardly been any presentations. So how can I see more patients? And immediately, because he was confronted, he realized his mistakes. And he took his remarks back and he apologized. Emergency department and wards can be very busy. The teams can often have 2 or 3 doctors, including a consultant, looking after 50 plus patients scattered all around the hospital. There would be a ward rounds, orders, referrals, documentation, medication charting, OT assistance responsibilities, and answering your page all along. But I find IMGs can be particularly slow, especially the ones who have career gaps or limited clinical experience in the home country. And they are potential targets of complaints and concerns by the doctors, by the nurses, and even by the patients. Also in the ward, I observed local medical doctors would do things on the go. They would chart medication, answer the pager, generate referrals through text and speed dials through their personal mobile phones. Very smart indeed. Now, there will be no one telling you on the floor, on the ward, that you are slow and you're not effective or efficient. But during your term assessment, the consultant would comment together that doctor is slow, sees only 2 or 3 patients, is delayed in terms of completing the task. His knowledge is lacking, his skills are basic. And this can be a big problem for someone because if their performance is below the safety level, they would certainly fail that term. Yes, there is a thing called failing a term, meaning that you have to repeat the term later afterward. Now, I've had a fair share of complaints and compliments in my medical care here in Australia. However, I do find more complaints from nurses and patients on small issues, often labeled under the umbrella of under or miscommunication. But let me tell you, I have learned a great deal from each and every one of my complaints, and I'll give you an example. Once I was on an ICU night shift. It was close to about 1 a.m. and I was in my office checking some results. An ICU male in charge nurse came to me and said that he's been out on a night shift for a number of weeks and he's not been able to go and see his GP because of his chronic neck pain, because he's got arthritis. And I felt sorry for him. And he said that, look, I've been taking my Panadine Forte, but it's not strong enough. And would you be able to prescribe me something? I felt genuinely sorry for that male nurse, working hard, unable to see GP, and I offered him to write a script of an endone. A few days later, I found myself sitting in my director's room, explaining why I prescribed an endone to a nurse, that my good intentions of favor had been returned with a complaint I literally felt cheated. Luckily, my consultant handling the complaint knew me very well. He said to me, anyone asks about analgesia, ask them to go down to hospital, emergency department, get triage, be assessed, and get whatever the painkiller they want. The experience taught me a valuable lesson of professional boundaries and importance of following the protocols. There was once a patient with chronic pancreatitis who would present to the hospital ED every few weeks with severe abdominal pain, asking for IV morphine. At one such presentation, I saw him. Realizing that he's opioid-seeking behavior, I saw that he's already received 5 milligrams of morphine by the ambulance. I would not give him any more additional morphine. He said to me, "Doctor, you're making a mistake." He later lodged a complaint through the ED director. The director was a rational person, and he said to me, for such patients, it's better to manage the acute component of the pain and refer him to pain management services. So my second learning in this area was, don't be judgmental. Maybe he has got a genuine issue, or maybe I need to be a bit more careful about my choice of words. Number 3, exams. Now, as I said, Australian College of Emergency Medicine faced a complaint back in 2017 lodged by a group of IMG saying that they have been consistently discriminated against when it comes to passing the OSCE component of the final fellowship exam. The independent inquiry did establish a degree of bias, and the report recommendations were to have the OSCE component of the exam be very clear and concise about the marking pattern and schema. There was also a recommendation that there should be an independent examiner, like an examiner on top of an examiner, so he can scrutinize what is being assessed and how things are being marked. And all OSCE stations should be recorded. There are still good trainees out there who have not been able to pass the final AD fellowship OSCE, GP final OSCE exams, and they've lost their training time. And yes, majority of them unfortunately are international medical graduate. Lesson: as an IMG, one has to perform 10 times better than the local counterparts to even stand a chance of passing the exam. But even more importantly, we ignore tactical strategies to pass the exam. It does not require only the knowledge, but also the presentation of the knowledge in a prioritized and a structured manner. And that's the point where examiners get biased, when they compare the white candidates to an IMGs. Denying that the presence of bullying and harassment within Australian healthcare culture would be absolutely wrong. I like to share a particular disheartening experience involving a respiratory consultant who targeted me and also other IMGs. This consultant would come up with serious allegation of smallest of issues and will be very rude in his conduct. Despite me lodging a complaint against him, the issue saw little resolution. So let me say it plainly to all doctors, especially IMGs. If you ever feel that you've been discriminated or bullied or harassed, lodge a complaint immediately. Do not worry about your progression of your career. Your mental well-being will suffer, and you might not even have a career left if the mental toll takes the better of you. My experience of working in the UK versus in Australia. Now, I found working in the UK was super busy, with me often running like a headless chicken, trying to do ward work, pre-ops, OTs as a single doctor on a team of 3, which included my consultant. So there was a registrar, me as an SHO, and then there would be consultant, and we would have 30 or 40 patients under our care. The life in the UK as a junior doctor was so stressful. I was under a constant hammer of emphasis of passing the membership exam to have that career progression, applying for jobs to move on in my career, and constant threat of visa that was often linked to the jobs. Unfortunately, there was also covert bullying and harassment. I remember this orthopedic surgeon that I was working with. He completely changed because I was unable to attend his housewarming party. As a matter of fact, because he was my current employer, I was using his name as a reference, which I informed him about. But when I decided to use that reference, coming to Australia, one of the local employees said to me, "Rizwan, I'm going to tell you something very straight. The reference that you're using is not good. Find another reference," which I did, and I was able to find a job. My recommendations. Number 1, be efficient. An IMG is always admired if he sees good number of patients, sort all tasks with clinical prioritization and patient safety in mind. Number 2, communicate. I feel there's a lot less animosity if you talk to people around you, especially the medical and nursing staff and your colleagues. Number 3, never accept bullying, racism, or harassment from a patient, nurse, or a doctor and report it immediately. Number 4, when it comes to professional exam, be strategic, be smart to complement your hard work of preparation and presentation of your knowledge. Finally, remember, there will always be some issues in a new system. There will be complaints, there will be complications. Means that you are learning and growing. The point that I'm trying to make is that try to learn from these issues to make yourself strong. and help others along the way. It's sad to see when many of the IMG consultants turn to IMG junior doctors, not helping them, but actually repeating what has happened to them earlier in the system. Look after yourself and each other. Goodbye.